Hi everyone, you're listening to Let's Psyconnect, and this is LT. I also want to invite you to watch this conversation I'm having with Dr. Jackson today. The episode is going to be available on YouTube as well as on my Instagram page, Let's Psyconnect, and it's going to be over the IGTV slot. If you can't find it, that's all right. Just send me an email over connect@letspsyconnect.com. And without further ado, let me introduce you all to Dr. Jackson. She's a licensed clinical psychologist, which I hope to be very soon. And she's the owner of Healing Spaces Psychological Services, LLC, located in Clinton, Missouri. Healing Spaces aims to provide comprehensive, quality, and inclusive psychological services to members of the St. Louis community, particularly those from traditionally underserved populations. Very important. As a clinician, Dr. Jackson provides assessment and therapeutic services for children with emotional regulation difficulties and oppositional and defiant behavior. And we're going to talk about it in a little bit. She also provides therapy to adults experiencing symptoms of depression, anxiety, and difficulty with life transitions. She obtained a Psy.D. clinical psychologist, so she's one of my team, okay, Psy.D. from the Loyola University in Maryland in 2016. And she completed an internship over an APA-accredited site called Terry Children's Center, a residential treatment center in Delaware. And she completed her postdoctoral fellowship at the Center for Behavioral Health, so CBH. She has been trained in CBT, something that I'm also a big fan of, trauma-focused CBT, parent-to-child interaction therapy that I don't know anything about, and in their sequential model of therapeutics. So that sounds like a big word.
Yes.
A developmentally sensitive, neurobiologically informed approach to working with children with complex trauma histories.
Yes.
So thank you for Psyconnecting with me.
Thanks for having me.
Let's Psyconnect with Dr. Jackson. So it's a privilege and an honor to have you here to tell myself, right? Tell me and the audience a little bit about yourself, your work, and go from there. Let's see. Okay.
Sounds good.
So I just share a little bit about your background with some of the highlights here and how I connected to that as well. And my audience probably knows by now anyways that I am not a child psychologist and I don't work with kids, but for some reason I keep on connecting with those who have experience with children, and I'm very glad to do so because I like to learn from those that, it can help me also understand your work and the work of mental health professionals, again, that facilitate treatment to children or young adults. And, I think it's important for other mental health professionals to learn more about it. And also, I become more empathetic towards parents and towards the children themselves. So what drove you to pursue this career, first of all?
Ooh, okay. I'm going to say the cliche answer where I legit wanted to help people.
Got it.
But I remember sitting in AP psychology in high school and just learning kind of about the intro and using that as a way to help people and to serve people. And it just clicked. And from that day, I decided that I was going to be a psychologist, and I just pursued whatever training and education I needed to achieve that goal. So shout out to my teacher at the time. Couldn't tell you their name, but they were super helpful.
Hey, I'm grateful for the teachers that you had because they brought you here. It is a cliche, and I'm not gonna lie. When people ask me to, I try to elaborate on a different answer because I know they want to hear something else. I'm like, are you pleased with my original answer?
Yep.
I'm glad that we're here to help others anyways.
Yes.
And so we talked about different approaches, right? CBT, trauma-focused CBT, but tell me a little bit more about, what it is like to work with children versus adults, and also using some of the other approaches that I mentioned, NMT, visual I. and PCIT.
Sure. So one thing that I found working with children versus adults is that when you're working with children, it requires more of a collaborative approach. So when I'm working with kids, I'm not only working with the child in the moment, but I'm also working with their parents, their caregivers to reinforce some of the things that we've discussing in the room, because therapy is only an hour. Like, as much as I love what we do, we're not going to make such a big difference in 1 hour. You have to take what we talked about and kind of apply it to home, which is certainly important for children. As well as I often collaborate and consult with teachers and other clinicians and providers as well. So definitely taking a team approach to make sure that the kid gets whatever that they need. And depending on their individual services, I pull from a lot of different trainings and backgrounds. So PCIT is a very structured form of just working with defiant and oppositional behaviors, which I really love because it's kind of step-by-step approach, and parents can find that really useful. So it's kind of like we're starting at the beginning and we're going from there. And they get a lot of feedback from the clinician regarding what works and what's helpful. And they practice it and kind of do it in the room. So I love that approach because it's not just talking about it, but it's like, okay, I'm going to teach you what to do. You're going to do it. I'm going to give you feedback in the moment on what you've done, and you're going to take that home and kind of do homework on that. So I'm a behaviorist at heart, so I really like PCIT. I'm sad I haven't used it as much as I like to. And then NMT is just that developmental approach of kind of conceptualizing how trauma, chronic developmental trauma can impact behaviors. So a lot of the times, parents might come to me and it's just like, my child is acting out. That could be for so many different reasons. So when you look at a child who's had significant trauma in their history, that approach kind of gives me a different lens of conceptualizing the kid, thinking about the kid and what they need. So that can help tailor services as well. But working with kids requires lots of patience and lots of hands-on activity as well. Like, I've done sessions on the floor. I make sure I wear pants and lots of toys, and I'm well versed in Uno and Sorry and all that as well. So.
See, that's what comes to my mind when I think about child psychologists or mental health professions that provide treatment or services to kids. I think about like drawing and games, and I'm like, well, it can be a lot of fun, and then it becomes a challenge when you start working with the parents.
Yes.
But I'm sure there are other ways to look at that too, because I don't think it's always necessarily like fun, because you're looking at other aspects, because it's you as an adult, you're in one level developmentally, and then try to communicate with somebody who is not there yet, so you try to get to their level and bring the child out and still being an adult. So I'm sure it has it comes with challenges to you, and also learning of some of the events or experiences that they go through, and sometimes not siding with them, because you wanted to protect the child or the children. It can be very hard to just like, what, nobody comes closer, I'm protecting the child here.
Yeah, you're definitely navigating a lot of different needs in the room and empathizing with different parties. So like, children have their own needs and difficulties, and kind of seeing where they're coming from, because I like to conceptualize or think about some of those oppositional or explosive behaviors as like, what is the kid trying to tell you, or what is a need that is not being met. So kind of looking at it from that point of view, and then also empathizing with the parents as well, because if you're having a lot of these behaviors, it's really hard to parent and to caregive. So kind of making sure that both parties feel validated, and also giving them the skills that they need to make a difference, because what's happening is not working. No one's happy. So let's change that.
And based on your experience, and I guess and knowledge, do you feel like there's a lot of pathologizing of the children's behavior when it comes to seen as oppositional, and also when it comes to seen as defiant, and just looking at that child or a teenager, it's like there's no future, you're gonna end up in jail, you know? And so what is that like?
I think that can be very challenging. So like I said, sometimes I have to take a step back when I'm hearing a child described that way, and again, empathize, like a parent wouldn't just describe their child that way unless they were struggling with the behavior. So I kind of think about it like that, like you're struggling with some of these behaviors, understandably so. And that's how we're getting to the point where, you know, kids are being described as X, Y, and Z. Also, I inform them, if you think your child, I hear a lot, my child is bad, my child might be X, Y, and Z. If that's the lens in which you're looking at them, you're interpreting a lot of behaviors very negatively. So working with them on challenging that, or at least identifying that, as well as kind of pointing out and reinforcing a lot of the positive things that the kid is still doing. So from a behavior perspective, we want to reinforce the behaviors that we like. And so making sure that they're also paying attention to those adaptive behaviors, because kids aren't bad. They might exhibit some naughty behaviors that we don't like and want to fix. But there are some things that they're doing that you do like. So let's start there. Praise that, emphasize that, and kind of take it one step at a time.
This in my mind when working with children and also their parents is the bias that we sometimes come with, just I guess the session or it's the environment, thinking like it must be the parent's fault. The parent has to be doing something wrong, so the child is this way, or the parents themselves blame themselves for whatever's going on with the child. And so I don't know like how it is very difficult for us to, I guess, be aware of the biases, and we work as mental health professionals very hard, you know, to be aware of our biases and those beliefs that I guess society has imposed on us or that we have grown up with. But it's also a reality, you know, so again, like we have to keep in check. So when we walk through a session to know if like, are we putting the blame, or we're just like creating or recreating the cycle that they themselves see outside of our own. Do you have any thoughts about that?
I mean, I think it's something, I totally agree. And it's definitely something that happens, which just like I said, like we want to praise the things that the kiddo's doing. We want to highlight the stuff that the parent is doing right as well. And just being mindful to, like I said, take a step back. Because I mean, I'm on the verge of having my first kid, and they don't give you any instruction manuals for this stuff.
No,
no, I've been waiting, like it's not happening. I know it's not gonna happen. So I like to think of parents as doing and caregivers as doing the best they can with the information that they have. So, and this could be, you know, they could have gotten their information from things that they've seen growing up, which might not have been super helpful, or it just might not have been good child upbringing. They're just basing it on a lot of different information. And it's kind of like I said, just trying to empathize with them. And like, you're doing the best you can with what you have. And let me tell you some things that I've learned and that the research has showed that's helpful. And let's just work together to modify it. Like I'm the expert on certain things. You're the expert on your child. So let's work together to figure it out. And I like to take a collaborative approach, because the parents involved, it's not just your fault. Like hard, these behaviors are hard. So get everyone on board to help the kid achieve their greatest potential.
For sure. Yeah. Again, I cannot imagine doing the job that you do. I'd rather work with my medically compromised population.
I get it. It's not for everyone. I get it. And I love it, which I think makes it so easy for me. Like there's certain aspects of the job that are not easy and they're challenging for sure. But I love it. And I love, like, especially with like certain behaviors, We can, what's the word I'm looking for? Like we can watch and count how the behaviors are, we can see progress is what I'm trying to say. Like we can see behaviors decreasing. Like it's just so fulfilling to like talk to a parent and say like, you did that and this is how you help contribute to change, and look at the child and they're exhibiting good social skills and emotional regulation and just kind of celebrating with them. It's just, I just love it. I just love it. It makes me happy.
Do you keep a checklist of like emotionally regulated check? I mean, like it's so nice. You give them a star, or give them popsicles, or something like that.
Hey, that's one thing I miss.
I love it. I love your energy.
Oh, thank you. Yeah, that's definitely one thing I miss about being in the office. Like, you deserve a sticker, like handing out stickers and trophies and certificates. Like, you all are doing a great job and you deserve to be rewarded.
We're gonna find some emojis to send virtually. Like,
yeah.
Hey, you did something nice. Here's
exactly.
An emoji your way.
Exactly. That's a good idea. I'm gonna look into that.
Yeah. There we go.
Thank you, Auntie. Thank you.
And then I'll also never get it. I talk about one is like to own your own place, you know, the healing spaces, psychological services. And so what it's like to be your boss, and also to transition from, I guess, being the owner and also being the therapist. And I hear that you're expanding and you might be training others too.
Yes, it's definitely been an interesting journey so far, and one that I never expected to be on when I graduated. But hey, life throws you all types of changes. But I'm glad to be here. And it's hard. It's hard because, you know, school they train you to be a clinician and to work with people, and less on like, if you want to start this business, like how do you do it and how do you navigate it? So that's one thing that's been really challenging, because now I have to split my time between running the business and then also helping people. And sometimes it's not fun to be in both of those roles. But I will say it gets easier as time goes on, for sure. And over the last few months or so, we have expanded. So it went from being a solo practice to I hired a new employee, and then I also have students that I'm training as well, and that's been really fulfilling. And with that extra assistance, then I can kind of more so delegate and have them work with just more clients in the community, period, and kind of do different roles and not feel so overwhelmed at times.
Yes, and I, say thank you for that too. It has not been easy. I can only imagine. I don't necessarily see myself as the owner of a private practice like that, or community mental health. But then again, neither did you, and so who knows? What I think the takeaway here is that it is possible, and to not close your mind off, to the possibilities that come with being a psychologist, and the values associated with being a mental health professional, and how to make your own space to be aligned with those values. And you're doing that. And that's encouraging. It's motivational. It's inspiring. And you're expanding. So, there's opportunities for you to bring students on board. There's so much passion for what it is. And like, I can see in your face. I hope the audience the listeners can also see that, and of Of course, and I can only imagine that what it would be like to working with you and being a student under your umbrella, and you know, following like a CBT supervisory style or like a behavioral approach to supervision, and having goals as, and at the same time being developmental. And I think that's awesome.
Yay, thank you.
That's
I hope they think it's awesome too.
Oh yes. you make sure that they call me and say like, okay, it is awesome. Okay, you got that. What might be though? What might be the reason why you chose working with the underserved population, and how would you define that?
Ooh, now that's a good question. I like to think of it as serving individuals who might be left out or might not have access to services based on different cultural factors, like, you know, race and ethnicity, socioeconomic status, and making sure that we're giving quality and what's the word? Like I said, like just inclusive services to people, and making sure that we're considering like different cultural things when we're working with clients. So that's something that I, even before grad school, has always been important to me, and just being a Black woman is important to me, and making sure that others in the community are getting access to the services that they need, and them as a whole individual is being kind of recognized and understood.
Thank you for that, for sharing your view of it, and what motivates you so much to work with that population. It can be very easy for some professionals to choose to work with clientele from, I guess, high society and whatnot. We do have to pay our bills, right? And charge a lot of money, because we often hear about some professions that charge, I don't know, $500 an hour. I don't even know. I might be making it up, but it's possible that some people are
There's
charging
probably
that.
someone, yeah.
I also think maybe New York City, I'm not sure. I think that being able to identify the gaps, and being able to try to reduce the gaps, especially when it comes to provide the population or the individuals who are experiencing stigma, and there's so much stigma also associated to mental health. For instance, you know, there is a stigma surrounding like white people going to see mental health professionals. There's a lot more stigma, you know, if you put in the scale, because of many different reasons, when it comes to people of color seeking mental health professionals. Certainly. And I think, if you want to share some thoughts about that too.
Yeah, no, that's definitely true. So a few things came to mind as you were speaking. So one, let it be known, I'm a business owner too, so there are certain fees associated.
Yes.
So we're not charging $500, but you know, I gotta eat too. And so there are definitely definitely fees that are make sense with education, training, etc. So, you know, we gotta set that are appropriate for that. But also, one of the things that I pride myself on to fill in those, like making sure that we're offering pro bono services to clients that need it. That's another reason why I wanted to bring on practicum students and interns as well. They can offer much lower or even pro bono services to clients in the community. So that's something financially that we wanted to, I wanted to address for sure. Are you still here? Okay, I'm just checking.
Sorry.
No, you're fine.
Hi, folks. Yeah.
That's fine. And then also, the practice is primarily right now Black and women owned, and well, it's Black owned and mainly operated. So that's something that was really important for me, especially being in St. Louis and being in the community, because like you said, there's a lot of stigma just based on history and history of racism, things like that, where people of color don't access services because of things just that have happened in the past. Mm-hmm. So being an agency, like wanting to be here and create a safe space for people to not only, just to seek out help and to seek out change for their mental health difficulty, and to let them know that it's okay. Like, it's okay to seek these things, and we're here for you, and we'll help, in whatever way that we can.
Yeah, I actually attended a presentation today that focused on African Americans, and some of the content that they discussed is also applicable to other people of color, meaning like Hispanic, Latinos like myself, and then other groups too. They're not predominantly or identified as white and whatnot. And so the information to consider too is like spirituality or religiosity. If I said that correctly, religion, and understanding some of the cultural beliefs and practice, and also establishing connection in the community. It can come a long way when it comes to fighting stigma and making those folks welcome in whatever environmental, like agency or hospital setting. Because you can set up a hospital, you can set up an agency or private practice, but for those for that type of population, it's important to build a connection within the community, and so understanding what can make understanding how you can make that person or those people feel welcome. It can make an impact versus not trying to apply the same thinking that. What I'm trying to say, like, you can open up a space and put a banner outside or put an ad on Instagram or whatever, and it might work, I guess, for folks from a white background, but it won't necessarily work for people from like the Black community or Latino community, and so you have to go sometimes to like a church or speak to the leaders and so on and so forth, so that they trust you. There's a lot of trust. You understand what I'm trying to say here? I feel like I'm like going around.
No, you're making a lot of valid points. Yes.
They said it's so beautiful in the conversation, in the talk that I attended to today, and I'm trying to replicate it. I'm like,
you're doing it. But yeah, you're so right, and that's one of the things that I want to hopefully in this post-COVID era, which should come soon. I'm optimistic. But as we've expanded, and there's been a lot of great things about technology that has allowed us to reach a lot of different people in a lot of different areas, and to serve people that I think would have hard time getting to. But I do miss being in my space and being able to provide in the community, and being able to I just have goals for the future as far as like how I want the agency to serve the community and do a lot of community service and things like that. So I do long for the time when we can see each other in person again, and we can physically help each other out.
Yes, looking forward to that point in life again. So for the time being, it's been a pleasure connecting with you and learning more about your background and what motivates you, and how you also what type of work you do with your patients or your clients. And hopefully the audience also got something from this too, and they are as inspired as I am, and hope to connect with you in the future when maybe things get better after the child comes along.
Yes, anything after that.
Yes, and to see how things are going for you and for your clinic as well.
Thank you so much. I appreciate you having me, and I'm always willing to sit down and talk. I love this stuff. So. Good.
Thank you so much. And for those of you out there, If you're listening to today's episode, Let's Psyconnect with Dr. Jackson, you can also watch this episode, which is available on YouTube as well as Instagram, Let's Psyconnect. And Dr. Jackson, where can they find you?
Oh, yes. So you can find us online, www.healingspacesstl.com, and then as well as on Facebook, Instagram, just at Healing Spaces STL.
All right. And if you didn't get that, that's all right. Go to my Instagram page or go to the YouTube description, and you're going to find the handle right over there as well. And remember, let's Psyconnect.
Yay.